We often hear the phrase food insecurity, but what does it mean? Food insecurity is when people are uncertain of having or unable to get enough food because of lack of money or other resources. Joining us now is Ochsner Eat Fit Nola dietitian Maria Terry with more on the impacts of health in our community. Thank you so much for being with us.
Yeah, thank you for having me.
And yeah, food insecurity affects millions of people in the United States, and a lot of times people on the outside can't tell. They have no idea. And this is something that affects both physical and mental health.
Yes, absolutely. When you think about the stress of not having access to the foods that you want to feed your families, it also comes from a financial stress. And when we carry that stress in our bodies, in our neighborhoods, in our communities, that has long-term effects on our future health. So our risk for chronic disease. The American Heart Association actually put forth a scientific statement that said that carrying stress is a risk factor for having further unhealthy behaviors such as smoking, which can lead to chronic diseases or heart disease or even stroke.
Wow. And the pandemic and Hurricane Ida, of course, have made this problem so much worse here in our area. A lot of times the lack of finances is to blame, but some people don't even have access to quality food within their living areas. That's known as food deserts, and it's a real problem in some parts of our area. Today, approximately 49.8% of New Orleans residents, live in these food deserts, where the nearest reliable grocery store for fresh produce and healthy choices is 5 to 12 miles away. It's just crazy that that's a real thing.
Yeah, not only is it real, but it is a reality for generations of folks. This has been a problem since before the pandemic, of course, but when you think about the pandemic and 2 hurricane seasons in the last 2 years that have been pretty hard on us, you layer in now just an immense pressure that we carry every day in our communities, particularly our communities of color, our Black, our Hispanic, and Asian communities in New Orleans. They're carrying a lot of pressure in order to feed their families, which then in turn creates a pressure to maybe pay for other things such as medical needs. Maybe those conditions that I spoke of earlier are harder to diagnose now, or they're getting diagnosed later because they aren't able to put forth those resources for food or for medical resources.
And I know you're supposed to get so much fruit, vegetables each day. What are some of the healthier and less expensive options people can buy if they only do have access to a local corner store and not a big, well-stocked grocery?
Yeah, I want to talk about fiber and I want to talk about protein. So fiber is so important for your gut health. Protein is important for your satiety, your hormone regulation. You can go to your local corner store. I've even seen and been in a few in New Orleans and helped them with this, providing these options. Dried and canned fruits and vegetables, oats, grains, nuts, and seeds are packed with fiber and some with protein. You can get shelf-stable protein such as canned fish or canned chicken. And if you are able to enjoy dairy foods, you don't have a lactose intolerance, milk, cheese, and yogurt, get that protein and your calcium. A lot of those foods are available year-round in corner stores. They might not be the most favorite items that you're going to see. They are going to be in the middle of the grocery store on the shelves, but it is so worth it to have them in your pantry so that when you do need them, they are there for you.
And you did just mention going into grocery stores and helping them, or going into corner stores. Partnerships like the American Heart Association and Ochsner Eat Fit Nola can help. So what sort of programs do you have in place to help here locally?
Yeah, absolutely. So the American Heart Association in Louisiana has particularly had a strategic approach with all of the food supply. So from top to bottom, ensuring there's not only access, but affordability of those nutritious foods. We also work together as a unit. So we have Propeller with Good to Go, American Heart Association, Liberty's Kitchen. We had a whole collaboration before the pandemic when was it? It might have still been in the pandemic. We worked with corner stores to bring in the produce and also the recipes, the ideas, the education behind how do I use these items. So you can find those nutritional nudge cards in corner stores. Ochsner Eat Fit will help with labeling, we will help with promoting and bring in different items, different shopping guides for the user, the customer, so they can make shopping easy for them.
All right, Maria, thank you so much for your time and everything you guys do.
Thank you so much for having us.
Michelle?